we've seen more cases of coronavirus right now than we saw in SARS. SARS was a virus. It's also a coronavirus, but this is a different strain. The new novel coronavirus that we're seeing in Wuhan is a similar virus. And in SARS, we saw about 8,000 cases total. We've already seen over 10,000 cases that have erupted in the first month that we've known about this. So it's there, it's fast, and it's spreading across the world.
And what does it do? Does it attack my lungs?
Well, so this coronavirus, it actually typically just attacks your upper respiratory system. So coronaviruses, there's a lot of different coronaviruses, and there are coronaviruses that aren't this strain that circulate all the time. And we see some forms of coronavirus that are there during winter months, and they cause symptoms like the cold. And you can have a little bit of a sniffle, you can have a cough, you can have a sore throat. You may not have any symptoms at all when you have a coronavirus. This coronavirus seems like it typically sits a little bit higher, so it's up in your upper respiratory system, but it can descend into your lungs and actually cause a pneumonia. So some individuals will develop pneumonia, some individuals can develop a severe pneumonia, and some individuals can die from this one, and that's what we're worried about.
So, but a lot of people are probably just going to get it. It'll be in their head. It's a bad cold and it goes away.
Well, we don't know that much right now. So, I mean, we're still trying to get a lot of information about it. So we know that there were some individuals, some of the more recent data that we have right now suggest that some individuals were relatively asymptomatic, that they didn't have any symptoms at all, but were still contagious and able to pass the infection on to other individuals who then express symptoms and actually progress to developing pneumonia. So we don't know, and you can be asymptomatic for several days while you're contagious and then develop symptoms as well.
Okay, that's scary.
Well, it's not unlike a lot of other viruses that we're exposed to. So flu, you can have symptoms and you can be contagious before that. Measles, you can be contagious before you have symptoms as well. It's a lot like any other virus that we have. The thing that's different about this one and the thing that's scaring everybody is that A, it's new and we don't know a lot about it. B, we hear about patients dying and we hear about the number of individuals and we see pictures of people wearing masks and walking down the streets in Wuhan and in China and people in airports and everything else. But we don't know. We do know that the reported mortality rate is higher than the flu, but flu's already killed more people this year than the coronavirus has. The problem is we don't know what's going to happen to the coronavirus moving forward. So we don't know if we should be really scared, if we should just be a little bit scared, or if we should just pay a lot of attention to it. It's still early. We know that it's really affecting Asia, China, Japan, South Korea, Thailand, now in Tibet, Singapore, other places. And it's spread across the world. So we now have cases in Europe, the United States, Australia, and we expect that it will probably continue to spread. The initial estimates for every individual that has this coronavirus, that they will spread it to about 2.5 other individuals. That doesn't mean that they're going to give it to 2.5 individuals. It means that on average, they'll share to like 3 to anywhere from 1 to 4 individuals. The most important thing that you can do during cold and flu season, and this is again a virus just like all of those other cold viruses that you see, is to wash your hands frequently. Wash your hands a lot. Wash your hands after you touch anything. Think about how many different things you touch during the day. You touch your door handle, you touch your car, you go to a restaurant, you wipe up against the wall. You really just need to wash your hands, and washing your hands should be very effective for this. Sure.
We see all these pictures of people wearing the mask.
Yeah.
Does that really make any difference?
I mean, masks in terms of trying to prevent an infection when you're out in public, when you're out in the open, viruses typically don't spread that well out in open air. They do much more if you're in a closed contact space. So if you're at a large arena, if you're at a concert, if you have individuals that are sitting and coughing and hacking on you, yeah, that's how you're going to pick up things. We don't know how long this virus will remain on what we call fomites. Fomites are just areas that you can touch where you can pick up things. Door handles, plates, countertops, other locations, anything like a bathroom handle, anything else.
We have pictures of a airport shuttle thing where it has those bars that you
Right.
hang on to.
Yep. And so those things are, you definitely want to wash your hands. I will be traveling soon, and I'm going to make sure that I wash my hands after I'm touching anything inside of the airport. But the mask in the walking around outside, it's not going to help you. The other thing that we know is that there's now currently a run on masks, right? So people are trying to sell masks, they're trying to do things. They probably aren't going to do that much for you. There's some debate about whether or not they'll help you on an airplane, but the problem is you still need to eat and drink when you're on the plane. And unless you're going to wear the mask the entire time, it's probably not going to do that much. And after you wear the mask for some estimates say about 15 to 30 minutes, it gets saturated with your own exhaust, the air that you breathe out. And once it gets wet, it allows viruses to move through it, and then you can inhale it again. So unless you're going to change your mask on a regular basis, it's probably not going to do that much for you. I have a lot of people that ask me if they should wear a mask on the plane. I don't wear a mask on the plane. I guess if they want to, they can, but I wouldn't spend a lot of money trying to buy a mask.